Hi everyone and welcome to my channel, the channel that's all about the art of being ill. My name is Caroline and today we're going to talk about medical trauma. So I decided to do a series about medical trauma because so many people with chronic illness are suffering from medical trauma. And also there are so many different types of medical trauma, and honestly I don't think this is something we talk enough about in society. So today's medical trauma that I want to talk about is getting admitted to the hospital. So let's just get started. So the first thing I want to talk about when it comes to medical trauma and getting admitted to the hospital is the whole getting admitted. And here I am mostly thinking about urgently and when you don't know why you're getting admitted. It's also traumatizing to get admitted, even though you do know what illness you have and that it's a flare or something, but that's a whole different type of trauma, so I'm gonna get back to that. When you get admitted to the hospital urgently, you are often in a state where you are very, very sick. You're most likely in pain. Maybe you have fever, maybe you have nausea, maybe you're vomiting, diarrhea, whatever symptoms you can have, and you don't know why you have the symptoms. You don't know what's going on. You don't know what's wrong with you. And that in itself creates a lot of anxiety. And then you get admitted to the hospital, you go to the hospital, and they start taking all these tests, right? They love needles at hospitals, let's just get that straight. But they start taking all these tests and you don't really know what's going on. The doctors and nurses might try to tell you what test they're going to take and why and so on. But you don't really know what's going on. You're very, very confused. You might be a little bit disorientated in reality. And so everything is just like, you can't do anything, right? You're just feeling like crap. And there are people taking you to test and talking to you and you don't know what's going on. So you're also really, really scared. You don't even know if you're going to make it out alive. You don't know. And that is a very, very traumatizing thing to experience, to go urgently into a hospital, not knowing why, not really knowing what's going on. It creates a lot of anxiety in you, a lot of anxiety. And often a lot of the tests they take, by the way, is very not comfortable. So on top of the pain you're already feeling, they start to take these tests and they, like I said, love needles. So often it's not necessarily pleasant tests they take. Of course, they're doing all this to try and save your life, but you're just so stacked with pain and fear. That kind of experience is traumatizing. It sticks with you. In my case, when I got urgently admitted, I talked about this a little bit in my last video. On my first video it was on my first video. I talked a little bit about getting admitted to the hospital. I was almost 22 when I got admitted urgently to the hospital. And I didn't know what was going on in my body when I got admitted. So I remember being in severe pain. I had pain in my stomach area and my bowel area, and it was like a cramping pain, and it was just very hard to explain how painful it was, but it was, the kind of pain you just can't, it's just too much, it's too intense, and I didn't know why I had the pain. I also had a high fever, and I had a lot of diarrhea. And I remember I called my ex-boyfriend to get him to take me to the on-call doctor. And I remember while I was waiting for him, I was lying on my living room floor in a foster position, and I was just crying from pain, and I couldn't breathe because of the pain. And in this moment, I had what I call a pre-near-death experience. And you're probably thinking, you had a what? This is a word I made up myself because I didn't have a near-death experience. But I was lying there and I remember that I got a signal from my body that basically told me I was going to die. This is it. You're not making it. So I remember getting ready to die. I remember the process of me accepting that I was going to die. And the scary thing was that a few months later, maybe 3-4 months later, my current IBD doctor, he told me that my infection number when I got admitted the first time was so high that the inflammation I had in my bowel could have spread and I could have died. Which means that my body was right. We were dying. I was dying at that point. And that, you know, honestly, I didn't think too much about it before my doctor said that. But after that, I was like, okay, this was a close one. And trust me, that's a little traumatizing in itself. But I go to the on-call doctor who has no idea what's going on other than that I have a really high infection number. So he gets me admitted urgently. And of course, the first one who comes is like a nurse, and she starts to give me antibiotics and pain medicine and all that. And then there comes a surgeon. And I was confused why a surgeon would come. But the reason the surgeon came first was because they had to make sure I didn't need to be urgently operated. I was terrified. I was like, okay, now they're gonna put me under and then start operating on me. I was like, at that point I could have panicked. But luckily I didn't need to get operated. And the next person that came was a medical doctor, and they had no idea what was going on. So I ended up having to stay overnight. They had the infection under control, and then I had to stay overnight. And then the next day I had to get a lot of scans and different testing done. And so my ex-boyfriend, he had to leave because, well, you're not allowed to stay there during the night when the patients are sleeping. And so I got into this room where there was this one other girl who was also urgently admitted. Of course, we didn't talk, we were both sick, but I was lying there in this dark hospital room and I could hear her, you know, moving around and stuff. And I was all by myself. And I was just lying there and I was thinking, what is going on? How did I end up here? Like, am I ever gonna make it out? Because that's the thing, you don't know if you're gonna make it out. You don't know what's wrong. And I was just lying there waiting for the sun to go up and for someone to tell me when I needed to go to some scan or whatever I needed to do. And honestly, that is like one of the most terrifying experiences I've ever had. And I don't think in the moment I realized how terrified I was, because I think I was in a kind of a state of shock. I think I was a little like, I couldn't kind of believe what was going on. So it wasn't until later I realized that that had actually traumatized me. And it took about 24 hours before they came with a diagnosis. And this brings me to the next trauma from being admitted to the hospital, getting your diagnosis. So when you get admitted urgently and you don't know what's going on, of course they're going to try to figure out what's going on with you. And they did with me and so many others. And but the thing is, you're sitting there and then the doctor tells you, and what does it take a doctor? 5 to 10 seconds to tell you what it is. And then they move on to explaining and treatment plans and all that. But in those, 5 to 10 seconds, your whole life changes. You might as well have died. When a doctor tells you you have this and it's a chronic illness, it will never go away. We can only treat the symptoms, but you will always have to deal with this. Your whole life it just goes away. The person you were, the reality you were living in, the life you had, gone. And now you have to start over. And you have to learn how to live in this new reality that you have. And that's a long journey, especially because one thing that I think is really a flaw in healthcare systems, despite the fact that we have, well, in Denmark anyway, we actually have a really good healthcare system. But one of the problems is that when you get this diagnosis, there's not a psychologist present. There is no professional who knows how to handle the kind of trauma it really is to get a diagnosis and told that you're going to be sick forever. There's no one present to take that talk with you. So this means that usually you would go into some kind of a shock, and then you go into denial and anger and all that till you accept your condition. But when you don't get help to kind of get over the shock and denial and all that, it can take years. You can waste a lot of years being in denial and ignoring and not wanting to deal with it, which often makes things worse. So I think that's a flaw. I really think everyone who gets a diagnosis, whether it's chronic or not really, but everyone who gets diagnosed, there should always be a psychologist present, and that psychologist should have a conversation with you about it, and they should offer more sessions. I really think that would help so many people. But that's not the case. So most of us, we just run around being highly traumatized without realizing it because we're in denial, including myself, because the doctor came into my room and told me that I had morbus Crohn. And my first thought was, I have what? I didn't know what it was. And she told me it was a bowel disease and explained a little more. And I remember thinking, a bowel disease, is that something you can have? I mean, I knew you could like have a lactose intolerant or gluten allergies or, cancer in the bowel or whatever, but I didn't know you could have a disease in the bowel. I had no idea. So for me, that was just like so surreal. And I was sent home that day with some medicine. And I was in complete denial of how this was going to affect my life. I remember, I think it was a Tuesday, I got out of the hospital. Yeah, I was admitted on Monday, and then I came home Tuesday. And I remember going to a party on Saturday. I was not living in my new reality. I didn't want to let go of my past reality. And no one helped me to do that. So I had to hit rock bottom before I started realizing my true reality and how traumatized this whole experience has actually been for me. And that was when I hit rock bottom in 2020 and went down with depression and anxiety. And it turned out I also had ADD, but I had to hit that rock bottom before I realized that my reality is just different from healthy people and the old me is gone. And actually, to be honest, it's a little bit traumatizing as well to think about how many years I wasted, like 8 years of my life trying to live a normal life despite the fact that I couldn't. It wasn't good for my health. I was miserable. I was in pain. I was stressed. I hated every moment of my life because I was in denial, and I was pushing myself way more than I could. So that's actually a little bit traumatizing to think about how many years I lost due to that. I am 31 now, and when I was 22, the 20s, all my friends around me, they were just trying to find an identity, right? That's when you create your own identity in your 20s, and you take an education, you start a job, maybe you move in with someone, and so on and so on. You kind of, that's when you go wild and you figure out who you are and what you want. And I was trying to do that, but I was unsuccessful because I was sick, but I was living in denial. So I'm in my 30s now, and it's not till now, and it's only because I went down with depression. But it's not until now, in my 30s, that I'm starting to find my identity and who I wanted to be. And I'm actually starting to figure out how to live again. And that's, honestly, it's a bit it's a little bit of a trauma for me that no one caught on before and helped me, no one talked to me about it. Professional. No one who's professional and would know how to deal with someone who just got a diagnosis. No one was offered to talk to me. And when you are in denial, you don't seek help yourself because you're in denial. So yeah, but yes, so honestly, traumatizing to get a diagnosis. Your whole life disappears. It's traumatizing to get admitted not knowing if you're going to make it out alive. And this brings me to the next trauma. So there's also the trauma of being admitted for several days, maybe even a long period of time. That's a whole different type of trauma. And this is because it's kind of like being in prison. The only difference is that, you know, if people in prison, they did something illegal. and people who are admitted to the hospital didn't do anything illegal. We didn't do anything wrong, right? But we have to be there. So now you're probably thinking, why is it the same as prison? And I'm gonna tell you. So the reason why it can be a lot like prison is because, well, first of all, you technically don't know if you're ever gonna make it out. You don't know. And you don't know when, for that matter. You don't know anything. And this also means that time stands still. Because you have no idea. And you can't do anything, right? You have no control of anything. You can only do what the doctor and nurses are telling you to do. The other thing is there's nothing on the walls. It's often just white walls. And you are often sharing room with other people. If you're lucky, you have a one-man room. But I think a lot of us have tried having to share room. You also share bathrooms. And for me, that's just, I hate that so much. I hate that. Ugh, I want my own bathroom. But you don't have that, you share. And the food sucks. Everyone is in uniform, right? Including yourself. You have a hospital uniform on, and the doctor has a uniform, and you know, this nurse has a uniform, everyone, the people who takes all your blood testing and stuff, everyone has uniforms on. And and it's highly boring. There's nothing to do. If you're really lucky and you're capable of it, you might be able to take a walk outside and get some fresh air. But otherwise, you're basically just locked in the hospital. And also there's visiting hours, depending a little bit on where you are admitted, I think. What section of the hospital you're admitted to, depending a little bit on the illness and everything. But often there are visiting hours. It's just like in prison. So you spend a lot of time alone. If you're lucky, there's a TV and you're just there. And like I said, time stands still. Sorry, time stands still. It's very depressing. And that's the trauma in it. You are in this prison-like world where you have no control. And everything is just, I was there the second time, I was there for 5 days. It felt like 5 years. And honestly, it doesn't make you want to fight for your life. It's so depressing. There is just no purpose in there. You don't really live, but you're not really dead. It's horrible. And I think I can speak for every person with chronic illness who says their worst nightmare is to have to go back. So for me, I was admitted after I got home from getting my diagnosis. I was in denial, which is probably the reason I ended up in the hospital again 1.5 months later. On my 22nd birthday, I may add. And that time I had to stay for 5 days and get treatment. And honestly, I was so depressed. I didn't want to eat. I remember a nurse coming with ice cream and saying I had to eat. She wasn't going to leave till she saw me eat. Because I didn't eat. I didn't want to eat. I didn't want to drink. I didn't want to go to the bathroom. I had constipation. Like, I couldn't go to the bathroom, and didn't want to shower. I think I showered once. I was there for the 5 days because it was I just couldn't stand it really. And I was just miserable. And I really felt like there was no point of anything. And when I finally got out, I remember I came home and I just fell on my knees in my living room and I kissed the floor. And I said to myself, I never want to go back. Of course, that was just like, you know, a wish that would never come true because I have been back since. But I really don't want to come back, ever. It was horrible to be in there. It was so depressing. Which brings me to the next trauma, the aftermath. So once you get out, you really don't want to go back. The body remembers trauma, which also means that the body will react to trauma. And this means that people will often get anxiety, maybe even panicking attacks, if they get symptoms that resembles the symptoms that had them end up in the hospital in the first place. Because the body remembers, the last time this happened, we went to the hospital. And everything in you starts screaming to not go back. And I suffer from that too. I have that trauma. That trauma is deep in my core. Of course, I've been in therapy for a while now and stuff. So of course, it's something I'm working on, but I don't think it will ever go away. I think I'm gonna have to live with that for the rest of my life. But I am so traumatized of this whole hospital thing that every time I have Crohn's disease, so every time I, for example, get diarrhea and I feel feverish, I start to panic. And that's despite the fact that, when you have chronic illness, you can have a flare without having to go to the hospital. You don't necessarily have to get admitted because you have a flare. Sometimes you can just get some extra medicine, or sometimes it just passes, but sometimes it passes. But even so, I start to panic. The fear is just kicking in because I don't want to go back. And I think I can speak for a lot of people with chronic illness when I say you have to get to a point where you can't take it anymore and you are certain you're not going to survive before you go to the hospital, because everything in your body, because it's been a trauma, is screaming, I don't want to go back. I'm not going back. I'm not going back. I'm not going back. I'm not going back. Like it's really horrible. Just talking about it, I can feel I'm getting a little, because I hate it. Even when I visit other people who are admitted, I feel sick. And I really do, because I'm just so scared of having to go back. And what if I get admitted again and the doctor finds something new? What if I don't make it out the next time? Or what if I have to stay for like 2 months the next time? And like all these things are just going through my mind. And of course, it's something I'm trying to deal with by different types of breathing exercises and stuff. But I am traumatized. And the saddest thing is that I have had these panic attacks before I realized I was traumatized. I've had the panic attacks every time I had flares and stuff, but I never realized that it came from trauma. I never realized till I hit rock bottom and started going to therapy and all that, how traumatized this experience actually was for me. It's so traumatizing. So my best advice, if you got admitted to the hospital and got diagnosed, recently, and and you haven't dealt with it, please do. Please see a therapist, because you will someday realize that you are traumatized. So that was today's video about medical trauma. And if you have also been urgently admitted to the hospital and getting diagnosed and maybe being admitted for a longer period of time, and you feel traumatized from that experience, please share with us your story in the comments down below. Also, if you really like this video, please give it a thumbs up. And don't forget to subscribe to my channel. And also, don't forget to go follow me on Instagram. My name on Instagram is, surprise, The Art of Being Ill. So have an amazing rest of the day, and I'll see you next time right here on my channel, The Art of Being Ill.